Welcome or welcome back to lift you up inspiring health stories. I'm your host, Tamika Bickham. I'm the founder and chief storyteller of TB Media Group, but for the purpose of this podcast, I am your health and happiness matchmaker. Now, before I introduce you to today's guest, you know what I'm going to ask you to do. Go ahead and hit subscribe right there on YouTube, turn on those notifications, and connect with me on LinkedIn. I'd love to stay connected with you. Now, today we are going to meet a truly incredible woman. She's an emergency medicine physician right there on the front lines of this pandemic. Her name is Dr. Naomi J.B. And today she shared with me some really important information. One stat I'll share is that 300 to 400 medical professionals die by suicide every year. That was pre-pandemic. So we're talking about mental health for medical professionals, as well as help for them as they go through burnout and just face challenge after challenge, pre-pandemic, during pandemic, and post-pandemic. So this is a conversation you're not going to want to miss. Our physical, mental, and emotional health is not just a want. It is a need for happy lives and prosperous businesses. Lift You Up is the podcast where we share inspiring health stories from business owners who are fulfilling their purpose to live their healthiest lives and helping you do the same. From former TV reporter to marketing entrepreneur and content creator, I care about sharing stories that matter and stories that connect us. I'm your host, Tamika Bickham, your health and wellness matchmaker. Well, I'm so excited today to welcome Dr. Naomi J.B. to the show. Hi.
Hi.
It's so nice to meet you virtually for the first time. I know we've connected via LinkedIn previously, and I've been seeing a lot of the great work you're doing there and how you're promoting Hope for Med and also what you do. So I'm excited to dive in and learn a little bit more about Dr. J.B.
Awesome. I'm so happy to be here. Thank you so much.
Thank you. Thank you. So tell us a little bit about what you do right now.
Okay. Well, I am a board certified emergency medicine physician, and I am working in Florida, which is the epicenter of COVID currently. I grew up in Florida. I grew up in an area called Pine Hills in Florida and left for schooling, and I went to North Carolina. I went to Duke University for my undergraduate training, and I stayed on for medical school, and so I am a double Dookie. And then I continued on and went to New York Presbyterian for my residency, and ended up working my way back down to Florida, and here I am with my family.
So tell me a little bit about your path after medical school and kind of how that evolved. I know you briefly touched on it, but I'd love to know a little bit more about your path and at what point Hope for Med came in.
My path to emergency medicine is interesting because when I started medical school, I wanted to be a pediatrician. I actually wanted to be a pediatrician for most of my life. And I started medical school, did my medical school training. And after I did my rotation peds, I realized, maybe not, maybe not peds. And so I really had this passion for international medicine. And so I thought, then maybe I'll go ahead and do internal medicine and then go on and do an infectious disease fellowship. That's kind of the path that a lot of people do when they're interested in global medicine and whatnot, global health. And so I was a third year in medical school. Going down this path, I was actually actively writing my statement for why I want to go into internal medicine when the earthquake in Haiti happened. And I'm from Haiti. I was born in Haiti, but raised in the States. And so I remember vividly sitting in front of my computer and just watching the National Palace just destroyed. And I said, I have to get down there. Lucky for me, as a third year at Duke, it's our research year. So I had some flexibility in my schedule, and the staff there were amazing, and they really supported me. And I was able to, within a week of the quake, I found myself in Haiti. I was determined, and I got down there.
Oh.
And working in Haiti after the quake, you were seeing so many people of all ages. I saw babies, I saw elderly, saw pregnant women, I saw patients coming in with like fractures and all sorts of things that you would see with post earthquake, right? Even though there's a natural disaster, people, that we were seeing were not just there because they got injured from the earthquake, right? They had, flare-ups of their congestive heart failure. Like there were
Right.
regular morbidities that we were seeing in addition to all that trauma from, musculoskeletal injuries from the earthquake. And so I remember working with a variety of different healthcare professionals, surgeons, and emergency medicine docs, because I did not know much about emergency medicine. Of course, there was the show ER when I watched a couple of those episodes, but I wasn't really, too into it. And I remember being like, what kind of doctor would I need to be able to have the skill sets to be able to respond to a natural disaster or humanitarian crisis like this, and to have the flexibility in my schedule to allow me to be able to do that? And, everyone kept saying, well, everyone, but most of them kept saying, emergency medicine, emergency medicine. And so that's how I got introduced to emergency medicine. And so I had not done a rotation in emergency medicine or anything like that. And so after I got back from Haiti, I said, all right, I want to be an emergency medicine doctor. And then, signed up for a rotation in the ER at Duke, and then went down this path.
So you were there, and that really kind of lit a fire in you as far as, okay, this is what gets me excited. This is what makes me feel passionate about responding to a humanitarian type of crisis like this, where I can really, really help and use my skill set.
Mm-hmm. Yeah, because my goal, I wanted to be a world-renowned international emergency medicine physician. That was, I wanted to. I loved global health, and remember I was like, oh, I'm going to go internal medicine, then infectious disease, and be able to do global medicine. But I realized through emergency medicine, I could do that, and that was initially my plan. And so from there, I became like a global health fellow through Duke's program. I intern at the World Health Organization in Geneva, Switzerland, and I was well on that path towards that, international medicine pathway.
And did that change? Is that what I'm hearing?
That changed, yeah. It changed slightly. Residency, I feel like I had more time to do things that I was passionate about in medical school than I had in residency. Residency was a challenge. And so I went to New York, and I had all the intentions of like really still being involved, getting involved in the UN and whatnot. And quite honestly, I had to focus to keep my head above water. Right? Like, and I tell you, you don't know much when you graduate from medical school. You don't know. And it's terrifying, right? Because before in medical school, you had this barrier, between you and the patient, right? Like what you didn't necessarily touch the patient. It was like pretend work almost, right? It had to be cleared. Like you couldn't put orders in the computer, everything had to be cleared through the residents before your suggestions would ever reach a patient. But now you're the resident, and that buffer isn't there anymore. And you're like, always second guessing yourself, like, oh, is this the right dose of Tylenol? How much, like the slightest things, like the smallest things, you're guessing yourself. And so it was a struggle. And so I wasn't able to pursue some of those things. And then I met my husband, and then, we got married and had children. And when I became a mother, I had to make a decision. And, the world was changing. And these humanitarian crises were becoming more complex humanitarian crises, right? Where you weren't necessarily safe because you're a healthcare professional, right? You can just wave that white flag and, oh, I'm a doctor, and don't kidnap me, don't shoot me, don't do any of those things, right? And I had these young children, and so I was like, well, do I really want to pursue that? Well, I have a baby, now I have two, but so I'm a mother of two, do I really want to put myself in that situation knowing that I could potentially, not be here to raise my
Right.
kids? Um, did I want that? And I realized in that moment, no, what was more important to me was being around for my kids. And so, I put that on the back burner and, got a job in the US and, took care of patients here.
Okay. And tell me what you're doing now in Florida.
So now I'm working full time as an emergency medicine doctor. I'm in the front lines. I worked last night.
Wow.
And, but with everything that's been going on, with COVID, and even before, I clearly remember in residency, I would leave a patient's room after a code. So somebody came in, they were unresponsive, they didn't have a heartbeat or anything like that. And, we worked our hardest trying to revive them and we were unsuccessful. And so I remember stepping out of this room, and in the hospital, there were like curtains, there weren't doors. So I stepped out of the curtain and I'm, in a sea of other patients that need me. And there was like a patient who came up behind me saying, oh, I need pain medications. And I just remember, it was almost like a dissociative experience where I was like, is this really my life? Like,
Hmm.
I just had this experience with this patient. This patient is asking me for pain medications. Like, I can't explain to this patient who's asking for pain medications what just happened to this patient because it's a HIPAA violation, right? And so, but I'm just like, wow, I don't even have time to process what just happened here, right? Because I have to take care of this patient and then I have a, waiting room full of other patients that I need to take care of. So when do we process these experiences? So that's a setup before COVID. And then COVID happens, right? And so with COVID, you have the day-to-day stressors, but now you have this invisible infection that, you're concerned about catching yourself, right? You're seeing your colleagues getting sick.
Mm-hmm.
You're concerned about bringing it home to your family, right? How am I going to keep my husband safe? How am I going to keep my kids safe, right? But I'm a frontline worker. I'm not going to be able to stay home and shelter in place or anything like that. I have to be there to take care of these patients. And so, I clearly remember when COVID first started and I was talking with some of my friends and they said, are you going to continue working? And I was like, of course, that's what I'm trained to do. I am. I'm going to get in my car and I'm going to drive into that hospital and I'm going to take care of the patients to the best of my ability each and every single day, because that is my job as an emergency medicine physician.
Hmm. Well, first of all, I want to say thank you so much for what you do because, just like you and so many others on the front lines, right? We needed you to say, of course, this is what I'm trained to do. And I want to continue to go to work every day because without you, where would we be, right?
Mm-hmm.
Where would you say from, your professional opinion, things are right now versus, a year and a half ago?
Well, I'm in Florida. All right. So we'll just talk about me being in Florida and what's happening
And as
current
a,
day in Florida.
yeah,
Right.
as am I and most of our listeners as well.
All right, fellow Floridians,
Yeah.
the Delta variant is out of control, right? And so, 18 months ago, we would have been like, yeah, it's out of control because it's a new thing. We didn't know, and, we don't know what the recommendations are, and we don't have a vaccination. We don't have this, we don't have that, right? Oh, are we supposed to wear masks or are we not supposed to wear masks? Like all those things were happening 18 months ago. Here we are today, and we're still having these conversations, right? And we're still having these arguments, and schools are opening and we're still having these arguments. And meanwhile, if you look at the data, I can tell you where I work, our hospitals are filling up. And that's the scary part, right? Is because, if we have beds to take care of you, we can take care of you to the best of our abilities. But what if we don't? What if we don't have space to place you? We have a finite number of of ventilators, we have a finite number of, materials in general, right? Supplemental oxygen, all those things. What happens when we run out of those things?
Is that a possibility?
Yeah, it is. It is a possibility. I mean, we have a shortage of nurses, right? And we just have a finite amount of places to put people, and before 18 months ago, right, it was starting out in like New York, Washington State, there were like these little pockets, right? And so we could mobilize people to go to those pockets to help, right? But now it's not in these pockets, right? It's spread, it's all over. So where are you going to get these extra healthcare professionals to mobilize and go help assist their colleagues that are tired, that are exhausted? Where are you going to get this? And the unfortunate thing is that this has become a political battle, right? It's Democrats versus Republicans, whatever. But as somebody in the front lines, I see this every day. I am taking care of young people, people in their 30s and 40s whose oxygen levels are in the 60s, right?
And to put that in perspective, where should they be?
The oxygen level should be 95 or higher. So oxygen levels are in the 60s, she's having a hard time breathing. We're giving her tons and tons of supplemental oxygen. So that's a terrifying thing, right? When you're seeing patients so young, right? Previously healthy, because before, right, 18 months ago, we were saying, oh, it's people that are not previously healthy, that have some kind of underlying comorbidity or whatnot that is predisposed, or the elderly are predisposed, right? And now we're seeing it in children, we're seeing it in young adults, we're seeing it in middle age. It's everywhere, and the numbers are growing. And the Delta variant is more contagious than the virus, the variant that was here 18 months ago. Right now, Florida's like this. Let's try to flatten it, right? Mm-hmm. So at least if it's flattened, then we're not growing exponentially, and then we flatten it, and then we can go ahead and help bring it back down.
Do you think we are in a worse off position today than we were 18 months ago, in terms of what we were talking about as far as the hospitals getting overwhelmed?
Well, in Florida, yes. Because Florida is getting hit harder than they had before. Our hospitals are fuller than they were before. 18 months ago, we hadn't been battling this virus for 18 months, right? So from the perspective of a healthcare professional, it was, all right, I put on my boxing gloves, let's do this, right?
Right.
And we're tired now. And so it's more like, all right, let's put on these gloves again and do this. It's different, and I think that is also concerning, because our healthcare professionals are burning out. They're leaving the profession. And that's what Hope for Med is about. It was created to try to combat this. Hope for Med was made the beginning of this COVID pandemic, and it was initially created to tackle the day-to-day experiences of healthcare professionals, the pre-COVID experiences of healthcare professionals, right? Yeah. And now we're living in the middle of COVID and seeing this. It's a rapidly increasing phenomenon of burnout happening amongst healthcare professionals, because they're just tired, they're overworked, they're stretching themselves thin, they're getting sick, their loved ones are getting sick, their family members are dying, their husbands or wives are dying. I personally know people who have lived through this experience. And what surprises me?
What?
And also I'm kind of like in awe or impressed by them, is that after their loved one died, they came back to work.
A medical professional after a medical professional after their loved one died of COVID
Yeah.
they came back to work.
Came back.
Wow. So what is your message as someone, like you said, who sees this every day to the public, to help, flatten that curve, slow the spread? What is your message?
Wear your mask. Wear a mask, right? Masks work by helping to limit the amount of viral particles, if you happen to be sick, that you push out into the air, right? It honestly does not significantly protect you from somebody else. So if you have a mask on and somebody that's COVID is talking to you, unless you have a N95, like one of those special masks, the other masks are not as effective, right? But if you have a mask on and they have a mask on, the amount of particles going out into the air to potentially infect you or them is lessened. It's like, having this barrier versus no barrier, right? It's better to have some barrier than no barrier to give you a better fighting chance of not getting sick. Right. So at the minimum, wear a mask. And, in terms of vaccinations, of course, I say get vaccinated. I can tell you, yes, I'm vaccinated. I got both of my doses. I'm fully vaccinated. But I am seeing differences in patients who come to the hospital that were vaccinated versus not vaccinated. First, most of the patients I'm taking care of are not vaccinated. It's, again, I'm not political. I'm just telling you the facts. Most of the patients that come to the emergency department are not vaccinated. There are some that are vaccinated. The other day, I took care of a woman in her mid-80s who was vaccinated, diagnosed with COVID. But she wasn't my 37-year-old who was short of breath with oxygens in the 60s that was not vaccinated. She was an 85-year-old with oxygens 95, not short of breath. Her vaccination status prevented her from presenting to me as the emergency medicine doctor like that 37-year-old mother of several kids. Get vaccinated, but at the minimum, wear a mask.
Right.
Have your kids wear a mask. Go to school with a mask. Go out with a mask. Let's just unify or unite.
Yeah.
As a people, as a country, we say USA, let's all unite and fight this thing.
Right.
And help your healthcare professionals who are getting burnt out.
And I do want to talk more about that. I just have one more question to play the other side, and the question that I hear from those who are hesitant. What I hear a lot is, well, they still don't know enough about the vaccine or about if masks work or don't work or whatever the other side of it is, where there's a lot of opposing opinions. So what do you say to people who say that?
Well, masks work, right? Like we were able to flatten that curve, without the vaccination being, like, the curve started flattening before vaccines were available, right? And what were we doing? We were staying home, we were social distancing, we were wearing masks, right? And that helped to flatten the curve. In terms of the vaccinations, if they're effective or not, of course, the research is still being brought into light every single day. But the research has shown that these vaccinations are safe. And I can tell you, as a healthcare professional who takes care of patients every day that I'm at work, I'm seeing a ton of COVID patients. It's like night and day between vaccinated and unvaccinated patients. Night and day. I can just say what I do, what I've done. I'm still here. I haven't had any adverse outcomes, that I've seen from the vaccination, except for maybe my arm sore. That hurt. But, besides that, like, I'm good. And I've not had COVID. As a healthcare professional, as somebody in the front lines, I am so at risk for getting exposed to this infection. And I've not caught it. And what do? Of course, I, try to abide by these recommendations. I'm always wearing a mask, whether it's the N95 mask or, regular surgical mask, right? I always have a mask on my face in the hospital and outside of the hospital. I'm at home right now, so not at home, but when I step out of my house, I wear it. I have my kids wearing it. I got my vaccination, just because I wanted to protect my family,
Yeah.
right? And I
And
wanted to protect
others.
my patients.
Yeah. What is your biggest fear, knowing where we're at right now, looking ahead through the end of the year? What is your biggest fear?
Well, as a healthcare professional, my biggest fear is running out of resources, right? Because I know what to do, I know how to intervene, right? But what is the use of me intubating you if I don't have a vent to put you on,
Mm-hmm.
right? And I only have so much staff that can sit next to you and bag you. But what about the next patient that comes in, right? It's all about supply and demand. And we know that the supply is limited and the demand can be infinite. There's millions and millions of people, right? But we don't have millions and millions of healthcare professionals working, and we don't have millions and millions of different instruments and materials that we need to really take care of you and help save your life, right? So once those resources run out or are very, very scarce, and we now have to start making decisions about, who gets this last vent, that's terrifying. And that's a position that no healthcare professional ever wants to be in. But that's a position we're going to find ourselves in if we don't flatten the curve.
And then the other part of that is also, keeping your medical professionals healthy and, you know, energized, able to work, willing to work, which I know is, part of the reasoning for founding Hope for Med. So I want to spend some time talking about Hope for Med, which I know started a little over a year ago. And so tell us more about it.
So, what I've realized, is that we as healthcare professionals, oftentimes our wellness is put on the back burner, right? We have to take care of this patient and that patient. Sometimes we don't even eat. But the problem with focusing on taking care of others is that, well, yeah, you get burnt out, right? But what happens to you and your health, right? And your wellness. And so what we tell our patients is, I think you should stay in the hospital. You can't breathe. And the patient will say, well, I have, this loved one that I have to take care of. And I'm like, how are you going to take care of this loved one when you cannot breathe yourself? Right?
Hmm.
We need to take care of you. You need to become optimized yourself. And then you can give care to that loved one. Right? The time has come where we need to focus on our wellness. We need some kind of resource that allows us to take care of ourselves, allows us, I call Hope for Med like a pop-off valve, a place where healthcare professionals can gather. It's a community of our own where we could go and share stories, right? And just release, right? Just release some of that burden of those experiences and those traumas that we experience day in and day out. There's only so much weight that we can carry before our knees start to buckle. Our knees are starting to buckle. And so Hope for Med is the goal of Hope for Med is to be that place where we can help alleviate some of that so that we don't get to a point where our knees buckle, so that it increases career longevity. And so we started with mental wellness and a focus on mental health because there's a huge stigma around that amongst healthcare professionals that needs to be tackled.
A huge stigma
Suicides,
around mental health in the healthcare profession.
I'll speak as a physician, right? The physician, you are taught when you're going through school to exude confidence, right? I mean, no patient wants a physician who, doesn't know what they or makes you feel like they don't know what they're doing, right? But that can be detrimental and backfire, right? Because it doesn't just stop there. We continue that in our lives and everywhere. So that's one thing. But then number two is that they ask about it on some of the medical licensing boards. When it comes time to renew your license, they ask about, have you seen a mental health professional? And if so, then sometimes that can prevent a delay, if not prevent you from being able to renew your medical license. It's unfortunate, and it's something that Hope for Med is tackling. And how do you tackle stigma? Well, you start by addressing it. You start by naming it. And you start by, really having conversations around it. And so the first thing that Hope for Med has created is a podcast. So we have podcasts where I feature healthcare professionals and I share their stories, because we all have stories, and it's about bringing back the humanity and humanism into medicine. And then we talk about, burnout and other mental health issues and suicide, which is a big issue amongst healthcare professionals. Even more reason why Hope for Med was created. And so anyway, so that's part of my way of trying to tackle the stigma, is by having these podcasts and having these conversations, as I, create the rest of the Hope for Med offerings.
Awesome. Do you know, I know you mentioned suicide, and I've heard that before. I don't know too much about how much that affects the healthcare professionals. Do you know offhand? I don't know if there's a statistic or kind of just how widely suicide affects healthcare professionals.
Every year, between 300 and 400 physicians die by suicide. It's the size of a medical school class. And that was pre-COVID numbers. And you don't hear that in the news. You see that in the literature. It's been an ongoing issue for 20 plus years. So, the concern is what's going to happen, after COVID, which is why something like Hope for Med is all the more important, to really be able to be that resource for, my colleagues, to let them know that, yeah, we're going through a hard time, but we're all in this together. And it's not just in the US, it's an international community.
And I would imagine this resource in Hope for Med is so important even right now, as we are going through this pandemic and just not knowing when the end will be.
It's when you go through a trying time that you really are able to really forge relationships and forge bonds. And, COVID is a trying time, for everyone, including healthcare professionals, because we're not immune. Again, we're getting sick also, we're dying also, but we're still coming back, many of us, to keep fighting.
Is there something that, whether it's in the support groups and the other medical professionals you come across, who are nearing burnout and really feeling the impact and the weight of everything that is going on, that you can say, hey, this is one thing that you can implement in your day-to-day life that will help bring you some sense of wellness?
I think, for me, I've really embraced the practice of gratitude. I think it's so powerful, because even in your darkest moments, you could find something to be grateful for. My daughter hugged me, and I love her hugs, right? It doesn't have to be, I won the lottery, I got $1 million, right? It's really focusing on those small things that really can help make you feel like you can do another day, you can face another day, you can do this again tomorrow. Really, is just looking for those things and encompassing a practice of gratitude in your life.
Have you taken a step back, a moment to take a step back personally and really process everything that you've been through in the last 18 months?
I think the creation of Hope for Med has really helped me do that, right? Because I took it from an idea, and brought it forward. And, through thinking of creating this company, it takes me away from work, right? Because I'm still working full time as an emergency medicine doctor. But when I'm not working, allows me to utilize my brain in other creative spheres. It's me reflecting on my day-to-day experiences and reflecting with others on their day-to-day experiences. And that's how I'm creating this company. It's a healthcare professional living it, breathing it, that's creating this company for us.
Well, I really appreciate that and the work that you're doing. I know that it's much needed. And tell everyone where they can connect with you, learn more about Hope for Med, follow Hope for Med, all the social media website stuff.
Hope, HOPE, the number 4, and then med.com is our website. And from there, you can listen to all the podcasts that we've created and read up on terms of what we're doing. From that website, you'll also have access to all of our social media sites. I'm very active on LinkedIn. And again, it's Hope for Med, LinkedIn, on Facebook, on Instagram, and YouTube. I go by Dr. JB, and so YouTube has a Dr. JB channel on there if you want to see me and hear me and listen. On YouTube, I've also included videos on gratitude that I try to do monthly because I think it's really important. And like you said, it is something that everyone can benefit from, not just healthcare professionals. It's beneficial for all people.
Absolutely. And I'll make sure to link to all those social media links, website, and everything below in the show notes, YouTube as well, so that people can easily find them. And, I really just look forward to, I'm excited to have the opportunity to share your story. And again, thank you for being who you are and doing what you do to save lives.
Thank you. I'm honored to be here on your show. And, thank you so much for taking that time to have this conversation with me.
Dr. JB really opened my eyes to some new information, statistics, data, experiences that I just didn't know about when it comes to medical professionals, pre-pandemic and during the pandemic. And truly, I thank her for all of her service, her work, for risking her life and the safety of herself and her family to help all of us, as well as all of the other medical professionals. They need really so much support, love, and help to get through this challenging time. So make sure you go ahead and just even offer encouraging words or connect below with Dr. JB, Hope for Med, and maybe share it with a medical professional if you are not one yourself. And hey, as I say every week, if you aren't already also connected with me, make sure you do that as well. I'm on LinkedIn, Twitter, Instagram, Facebook, all the places. But of course, I'd love for you to subscribe right there on YouTube, turn on notifications, and that way you won't miss us next week because we're back each and every week. And I know I'm going to see you next week. So until then, stay happy, stay healthy.